Hi everyone, my name is Alejandro Mena and I'm going to be going over three things today. I'm going to be going over pulse locations and marketing with this marker. I'm going to be going over reflexes and respiration. Let's get to it. So the first pulse location is the carotid. And to find this pulse, you're going to take your index finger and your middle finger and you're going to place it into the middle of your trachea. And you're going to slide to the right side till you feel a thump. And that's where you should feel the pulse. So I'll mark it real quick. It's like right here. This is where mine's at. So the next pulse location is a radial pulse, and this is by far the most common pulse to check for. So to find the radial pulse, it is located on the groove of your wrist where your thumb is located. So right about here. So the next pulse location is the brachial pulse. To find this pulse, you're going to take two fingers, place them on the bicep, and slide across to feel an indentation. You're going to apply gentle pressure and slightly move it upward. So it's around here. So the next pulse location is the dorsal pulse. And this pulse is located on the foot. So this pulse could be a little tricky, but if found well, it should be located right about around here. Okay, so now we're going to be checking the beats per minute of the heart rate. To do this, be sure that the client has their arm resting, and you're going to take your two fingers, you're going to take your index finger and your middle finger, and you're going to run it along the radial pulse. So run it through the groove of the wrist, right about here, have your hand resting. And I'm going to put a timer of 15 seconds. The average beats per minute is around 60 through 100, and my client here had a pulse rate of 75. Okay, so the next test we'll be doing is a Babinski reflex. In order to do this, you need a pointed object, and you're gonna run this along laterally on the side of the foot up into the big toe. So let's do it real quick. Just like this. So a normal result in this exam is for the feet to clench up and the big toe to abduct. So as you can see, hers clearly did, and a positive result of this will be no reflex at all. Okay, so the next test we'll be doing is a patellar reflex. So in order to do this, the patient has to be seated and have their foot dangling, and you need to find the tendon. So the tendon is located right below the kneecap around here, and you're gonna tap on that and see if there's a reflex, which the foot will extend if there is. There you go, good reflex. A normal result with this exam is, as you have clearly seen with my client, she had really good reflexes when I tapped on her tendon. An abnormal result will be very weak reflexes or no reflexes at all. Our next and final test will be checking my client's respiration. In order to do this, I'm gonna need to check her radial pulse. So have your hand resting, just like this, and I'm gonna check this for 30 seconds, and then I'm gonna multiply that by 2. So I'm gonna put a timer right here. So the way I conducted this test is I was sure that my patient was unaware that I was checking her breathing rate, which the average is around 12 through 20. A little pro tip to do this is you could pretend you're checking your patient's radial pulse, so that wouldn't interfere with the results.